everyone, my name is Mia.
And I'm Chloe.
And welcome to our second episode of EducAsian, where we're going to talk about the Delta variant and some misconceptions when it comes to the COVID-19 vaccine.
And once the spike protein is created, your body then recognizes that as foreign and starts producing antibodies.
And just as a disclaimer, none of us are epidemiologists. However, we do have a medical professional joining us, as well as a future medical leader.
Probably one of the number one things, like what if you don't have any clinics near you? What if you don't have a CVS or Walgreens nearby you? What if you're working 9 to 5?
So stay tuned for this week's episode. See you then.
Today we have our guests with us, and may I ask you to introduce yourself? Okay, hi, my name is Rachel Kim, and I'm a UNLV senior majoring in pre-professional bio. I'm a big foodie at heart, and I love creating makeup looks. That's my thing. As of like my school commitments and such, I currently serve as a College of Sciences senator and the Ways and Means Committee chair for CSUN Student Government. And in the future, I hope to attend medical school. That's the plan. And I've been really involved with the UNLV Community Clinic, and I've been working on a lot of vaccination initiatives.
My name is Ruchika Ranasinghe. I'm a pediatrician in the community. I have been practicing here since 2004. Not to give away my age, but
You look
Never.
super young,
Okay.
super good.
yes, so I've been
Like you could
practicing.
pass for 21.
Yeah.
Oh,
okay?
that's
We're all about
wonderful.
the same age, right?
Great to hear. Great to hear. So yes, I've been here for about 18 years, practicing in a underserved area in North Las Vegas. And I absolutely love what I do. I think kids are amazing, and I think we have a lot to learn from children because they're honest and they tell it like it is, and it's just a lot of fun working with them.
And not to get like on a serious note, but I know the Delta variant's kind of coming up right now. So would you kind of tell everyone about what really is the Delta variant?
So the Delta variant is a mutation of the original COVID-19 virus. And unfortunately, it has become the most predominant virus right now that's affecting everyone all over the world, really. And it's much more contagious, and it causes much more severe disease. So it's something that is, extremely dangerous, and everyone needs to be aware of it, and we need to do what we can to prevent contracting it.
I've been serving as a senator for almost a year now, and what I definitely found that students really care about is pretty much health and safety. We actually have this as a competency for one of our committees, university initiatives, and that's kind of a reason why I'm a big advocate for the vaccine, because I know that now that we're getting our education and we're going back to school, I think the worst case thing that could actually happen is just having an outbreak can occur, because we know that the Delta variant is more contagious, and we are also unsure as of right now with the amount of people that are vaccinated versus who's unvaccinated. And I think that's one of the things that I think we have to enforce.
And then how are regular schools dealing with are they making it mandatory for
They
people to get
have
vaccinated?
not made it mandatory for children, and it's not. It hasn't been approved yet for the elementary school kids, right? So under 12, but anyone over 12, people are encouraging vaccination, but it's definitely not mandated yet.
And I've heard that the Clark County School District hasn't even been releasing the statistics of how many children have been vaccinated and how many children have been sent to the hospital. The cases in the schools we're just not aware of.
Right. I
numbers look
did
like.
check. What they have released is the number of positive cases since school opened, and that's, I think it's over 1,000. 1,003 was when I last checked.
Wow.
So there's 1,003 new COVID cases since school started, and that includes the staff as well as children. I had a 3-year-old the other day in my clinic who was absolutely just extremely careful, wanted the mask covering the nose and the
love
mouth.
that.
And every time the mom's, mask kept slipping down, the kid would put it back up.
Oh my
So
God.
I
That is so
honestly
cute.
think, children are...
And they're 3?
That is
3
so
years
cute.
That's
old.
just a
And-
smart 3-year-old.
But
is
if you think
adorable.
about it, that's all they know as
Right,
well.
right.
Because they were
Wow, they're
very
pandemic
young.
babies.
Exactly. So they kind of grew with it.
I wanted to talk about a little bit more of the parent perspective. So may I ask if you're comfortable answering this question? Why did you personally vaccinate your children, and how old are they? And can you tell me a little bit about them?
Yes, absolutely. My children are 13 and 16. My youngest was 12 at the time that I got her vaccinated. And they were actually just waiting for the approval to get the vaccine because they wanted to be protected. And I told them, we went through the science behind it, we went through the statistics, how vaccines work, and I explained to them how this is going to affect them. And they, from day one, they wanted to be vaccinated. Not that they would have had a choice, really. But I made it look that way. But honestly, educating them, kids are really smart. Educating them is so important. And if by chance they had contracted COVID and they caught severe disease, they were hospitalized, I don't think I could have ever forgiven myself for not preventing it as a parent. So,
Why do you think, like, because I know you're a medical professional, you did the research with your kids, and so why do you think right now there's such a misconception when it comes to the vaccine?
there is a lot of false information out there on the internet, and I think anybody can put anything out there. And if you don't check the source of the article you're reading, then you can be misguided, and it just kind of spreads like wildfire then. So it's really important to check reputable sites.
Right.
I feel like this kind of became more of an issue, mostly because with the vaccine, it suddenly became a political stance.
You're
nowadays.
completely right.
But when you think about it, though, like middle school, high school, we were required for certain vaccines. So it's just really weird how the COVID vaccine became this political stance, and that's kind of why media is kind of enforcing this kind of propaganda of either vaccines really great or vaccines is
makes you magnetic or something.
Like exactly.
Yes.
Implanted.
Right.
Yeah, everything
Absolutely.
under the sun.
Exactly.
Yes.
Dr. R, if I may ask you, what misconceptions are out there? Can you educate us on what you've experienced or personally heard?
The way the vaccine works, the mRNA vaccine, which is the only one that's been approved for children 12 and up, the Pfizer vaccine. The vaccine contains mRNA, which is found in all of our bodies. It's a naturally occurring molecule. The vaccine contains this mRNA, which is injected into your body. It travels to your cell, enters the cell, does not get into the nucleus where our DNA is stored. That's where our genetic makeup is stored. It's outside the nucleus, and what it does is it's essentially a blueprint for the spike protein of the coronavirus. So it's not even the actual virus that it creates. It creates the spike protein. And once the spike protein is created, your body then recognizes that as foreign and starts producing antibodies. So when you are actually exposed to the coronavirus, your body's already prepared to fight the virus. The original mRNA that was injected from the vaccine has disintegrated by now and has left your body. So all you're left with is really your immunity and the antibodies that were made to fight this virus. So some of the misconceptions are that it causes infertility. I don't know if you've heard that one. And I think that came about because there is another spike protein which is involved in the growth and attachment of the placenta. So people, I think, confused that spike protein with the spike protein of the coronavirus. And before you knew it, people were saying, oh my goodness, the vaccine's going to cause you to be infertile. So that is not true. And they've done studies on women who have become pregnant. There was one woman who unfortunately lost her baby, but that was not because she received the vaccine. She was actually in the placebo group. The second misconception is that it contains microchips or tracking devices, or it creates a magnetic field and makes you magnetics. None of that is true. It contains the mRNA, it contains fats, it contains sugars and salt. There's nothing that will make you magnetic.
And what is the bad thing, even being magnetic, you know? That could be cool. You know, that could be cool. Okay, you know, stick a penny on me. Okay. You know?
True.
Like, what is even the bad thing about that?
I
Have you
suppose.
seen the actual like chip implant devices?
Yes.
They're huge. So they're ginormous. Like you
Wow.
can fit a microchip inside of a normal.
Exactly.
So, like there's
Exactly.
absolutely no way.
But there are people who actually believe it. Another misconception is that it can alter your DNA, but that can't happen because it doesn't enter the nucleus where your genetic material is stored.
Right.
So it's not going to alter your DNA, although, you know, with some we joke that maybe it might be a good idea. But yeah, that's a bad joke. Anyway. Let's see. People believe that if you get the vaccine, you can get COVID. The infection. No, that is not true. You cannot get COVID because the vaccine does not contain any part of the virus at all, whether it's weakened, attenuated, or live, or inactivated. There's no part of the virus that's in the vaccine, so you cannot get COVID. You can get sick from the immune response, which is fever, headache, fatigue, muscle aches, but that's your body reacting to that spike protein. And when you do have that immune response, that just means that the vaccine is actually working.
Right. What about like, because I know a lot of people don't even want to get the vaccine because they're like, oh, I know people with the vaccine and they still got COVID-19. What do you kind of say to people like that?
Exactly. No vaccine is 100% protective. There is not a single vaccine out there that's 100% protective. If you do get COVID-19, you will have very mild disease, and there's less transmission, viral transmission to other people. The people who get sick, who are in the hospital, who are dying, are the unvaccinated people. Anything else? Another misconception is that if you've already had COVID, the infection, that you don't need to get vaccinated. But immunity that's created from disease, well, it hasn't really been studied long enough yet, but the thinking about 90 days is when your antibody titers start weaning. But vaccine-induced immunity lasts longer.
Right.
Yeah.
So it's a very short period of time after you've previously gotten COVID. that
Exactly.
you have antibodies.
Exactly.
Yeah.
Exactly.
I've also heard of individuals with diabetes who are concerned about receiving the vaccine. Can you speak to that?
Well, I think that people with underlying conditions such as diabetes, asthma, obesity should be receiving the vaccine over anybody else because they are at higher risk of developing severe disease.
And can you tell us a little bit more about the community clinic? Like what initiatives have worked for you and what have you been...
Okay, well, so I got involved with the Unity Community Clinic when it was kind of like in the works. Like, we were actually initially, I was part of the community outreach committee, and we were thinking of doing like a flu drive, but then COVID happened.
Right.
But then I actually took up the role as the social media like co-chair for the UNLV Community Clinic's social media, which I believe social media is a very, very, very powerful platform, which is pros and cons, that's for sure. But actually up in the summer, I started learning how to vaccinate and draw vaccines during our time with, I actually went to like the last session of UNLV Pods to train, and then that's when we started doing more like community vaccination events with kind of what I was mentioning about with kind of going out in the community with supermarkets, grocery stores, churches, that kind of thing.
Actually, we were just so grateful for one of our partners, 888 Collectibles, right in Shanghai Plaza. So one of our offices is in Shanghai Plaza.
Yes.
So that's where we were doing our vaccine clinic.
Right, I
Yeah.
was there at one
and
of them.
Absolutely. We
Yes.
had the Sri Lanka vaccination day there.
Yes.
And we received $1,000 worth of Pokemon cards, trading cards to give to students for getting vaccinated. So that is absolutely one of our most recent initiatives,
Wonderful.
just to give away things and just shout out to them because they were so generous with
Right.
that. And we also have restaurants such as Brew Tea. So
Right,
thank you,
Brew
Brew
Tea.
We have
Oh, wow.
number one boba.
Right.
Chubby Cattle, we had Meat Fresh, just a whole bunch
Paletta,
of different,
yeah.
Paletta Bar, a bunch of different
Right.
restaurants that kind of just generously donated their gift cards and discounted goods just for people to get vaccinated. So
Right.
they all kind of joined in this initiative. And I think that location, people are shopping at Shanghai
Right.
Plaza and they're like, you know what? Maybe I should just get a vaccine.
Right.
So that was just right in the heart of Chinatown. So people were
Right.
walking and it was really accessible. I think one of my favorite stories was an 85 degrees worker just able to kind of go on their break and just go upstairs, get their vaccine, and good to go, back to work.
That's
So it was
Wow.
really, really easy for them to just stop by and take 15 minutes to rest and make sure there was no symptoms, and then straight back to work. So yeah, absolutely, I second that. There are plenty of cool events coming up.
There are.
We're doing pop-ups at First Fridays. That's downtown Las
Right.
Vegas.
Okay.
We're doing that the first Friday of
Mm-hmm.
September, the first Friday of October. So different festivals, such as the Pacific Islander Festival. I think that's just meeting people where they are,
Right.
and just hoping people get vaccinated. Right.
Exactly.
Right.
Even though there are not many like clinics at the North Las Vegas location, I know that the UNLV Community Clinic has done a couple like vaccination events, like pop-ups, like in that location. I know, I believe JD Middle School is in North Las Vegas as well, and there was so much people. Like,
Oh, really?
yeah, it was. We had a lot of vaccinations done, which was insane.
You guys just like
That's
went to the
fantastic.
middle school?
Yeah, like I
Wow.
said, it's like
Wow.
it's all about that location. Like
Right.
I think like churches, schools,
Trusted community.
Yes,
Right.
exactly. Like I think it's just way more comfortable, you know.
Right.
And like another thing that we're kind of doing as well through the UCC is something that Fire and Rescue does. They actually do homebounds. So essentially, people who can only stay at home. If you call at a certain number on Thursdays right now, like a fire and rescue member, EMS, I believe, will be able to go to their houses, give them the vaccine, and then if it's Pfizer or Moderna, then it would come back like after like Pfizer's 3 weeks and then Moderna 4 weeks.
Yes.
And so I think that's really cool too, with having homebounds and just
Right.
being able to just kind of travel all over the valley.
No, that's really cool.
So like that's what I did like actually last week, and it was kind of insane. Like I personally live in like Summerlin,
Mm-hmm.
and I met up with the fire and rescue member, and like we were somehow in Henderson, and then like around that UNLV area, North Las
Right.
Vegas, Northwest. Like
Very cool.
it was just very like cool, and just like being able to kind of also I guess serve for like people that aren't able to leave from home.
Right.
And I think that's actually like another way to kind of outreach to the community and just being
Right.
able to get that vaccination rates higher.
Can I
Right.
just ask, how do you advertise for those? How do people find out?
So with the UNLV community clinic events, I'm not too sure about the fire and rescue.
Okay.
Because I know that they have like flyers, but I'm not too sure where they actually advertise. But in terms of the UNLV community clinic, we have social media. It's a very
I see.
powerful like platform that we use, and I think it's probably like we have like kind of like partnerships with other like entities. So I'm assuming that that could be like another thing with how we advertise. So I think it's just kind of getting the word out just by socially, but also kind of physical, just kind of just to address like any economic barriers if they don't have
Right.
like phones or like technology. At least it could be something that you can actually receive from like a physical place. And I feel like another thing too is like with markets, you're always gonna have people just like going in and they'll be like, oh, there's a vaccine pop up,
Right.
and then they'll get the vaccine, you know.
Exactly.
So
You know, and I love that like homebound thing, because you know sometimes people who are homebound are the ones who need the vaccine the most, you know, and they're not able to obviously drive to like their 5-minute like Walgreens, you know. So I love that you can go to them. Like I think me and Chloe were discussing how you know, even though our vaccine clinic is in Chinatown, we're trying to make it more accessible for everyone. So we're trying to like figure out ideas on how to reach someone in North Las Vegas, you know, how they can come to our vaccine clinic. You know, we were just like figuring that out.
Reach people in Henderson.
Right,
or
right.
different parts of
Vegas, right? Because we don't want someone coming like 30 minutes, you know, taking the bus, you know, to our vaccine clinic, you know. So we were just like trying to figure out ways. So I love that like there's so many different just opportunities, ways for people to get vaccinated. Like, and that's how easy it is, you know. It's so easy to get vaccinated now.
yeah, like I feel like kind of like actually like last semester I actually took like a health disparities seminar, and that I feel like I was able to really like kind of put the things that I learned into perspective of like with COVID vaccines, because probably one of the number one things, like what if you don't have any clinics near you? What if you don't have a CVS or Walgreens nearby you? What if you're working 9 to 5? Like, not 9 to 5, but like you're working hours and hours and hours, and you just can't find the time to actually get a vaccine. Because I think that's something that we should also consider as well, because although I may not face it, and I definitely feel fortunate for what I'm able to do, like just being able to live comfortably, but I think it's also important to consider the perspective of someone who's very much struggling, or
Right.
they're not able to just make an appointment, or which is kind of why like walk-ins is like such a good idea, just to walk in and just giving that opportunity of like, oh, like I might not be able to come at this certain time, but if I can just walk in, then that's like another way to kind of just like beat the combat of like, oh, like the health disparities that are definitely presented in like underserved communities.
Absolutely. And even where I work, I have single parents, have, so many children, they take the bus, and it's just really difficult for them to access clinics. So I think that would be wonderful if we could actually go to them.
Right.
Or even if just like having like services where like you can kind of like, I know that with like Uber and stuff like that.
Yeah.
If, like I know like this is a very like first example that I'm thinking, like when people are like drinking and then people don't want them to be drunk driving, then Ubers will actually be able to get them, that kind of thing. I think that's what I've kind of heard, but it's kind of like that idea, but in terms of just like maybe if you're gonna get your vaccine, what if you are somehow able to offer the service of being able to transport them to the vaccine
I know Lyft
clinic?
did do that, right?
Yeah, we
For a
actually
little bit.
have a partnership with Made to Save is currently one of our partners that actually provided us with Lyft codes to provide that for our community members. Just get a lift to the clinic and not have to worry about that.
And was that free?
Yes.
Yeah, free.
Wow,
Free, and it's very
that's
generous of them.
amazing.
Yes.
Yeah.
Okay.
So, how easy is it to get a
There are
vaccine?
options. There are ways for you to
There's
get this.
options, locations, free Lyft codes. Like, what is stopping you at this point from getting the vaccine? That's really what we have to ask ourselves.
Boba, I don't
Free
know, there's so
boba.
many free things.
Incentives,
Right.
textbook vouchers,
Right.
Rebel Cat.
How about the incentive to just live, honestly?
Right. We just want to better the public.
Yes,
know.
Right.
exactly.
Yeah, like I definitely agree. Like having like vaccinations is very much of a community effort. Like you're not only protecting yourself and your family and your loved ones, you're protecting your whole community,
Exactly.
as well as the people that are immunocompromised, like people that can't even physically get the vaccine. So I think it's very much of a community effort, and I think everyone has to do their own part.
And all do this together.
Right.
And we can absolutely get our community vaccinated so we can open up better. We can build that better.
Right.
And come back together as a community.
Right.
So with that, I actually want to wrap up our episode today, and I want to say a special thank you to both of our
Right.
guests
Thank you so much.
for joining us. It
Thank
was
you
just
for
a
having
pleasure
us.
to have this conversation with both of you.
Yeah, you
Thank
guys
you
are
for
so
having us.
great.
Thank you.
Thank you.